the heart, the walls of the heart. So these are basics, right? And I want you to know this because we are going to talk about the function of the heart, the electrical activity of the heart. If these walls of the heart that are contracting and relaxing are not working, we need to know which wall is not working. Which one is the one that gives you heart attack? Which one that can grow or get larger and larger? And why, right? So then we're going to talk about them. The pericardium. Now, pericardium is not actually the wall of the heart. This is the covering. This is like, let's put it this way. The skin, not even the skin. Let's say that you got a piece of meat, right? And then you put it in a plastic bag, in a Ziploc bag. So that is the covering. It protects from the outside, not the skin. It's a protecting membrane. Now, remember, because you guys mostly likes to cook. Who likes to cook here? Who prepares chicken? Have you noticed that when you get a piece of chicken, particularly those that you kind of kill yourself and prepare yourself, and you see that they have a little membrane, white little tiny membrane on top? Yeah. That is a pericardium. It's very thin membrane, but it has a function there. It's got to be there for a reason, right? Now, this membrane is so thin, but still is made of two membranes. One on top, one on the bottom. So let's put it this way. So, we have this membrane, right? Let's make it large. Oh no, let's throw this away. Okay, so this is, let's say that this is the membrane, right? The whole thing here is the membrane, but it's very thin. It's like paper, like a sheet of paper. So this one that is on top is called the parietal outer layer. This is the parietal. And this one right here is called the visceral, which is the inner visceral. So it has a little wall, but it's so tiny that has two layers, one on top, one on the bottom. But in between, it's gonna have also some liquid. Let's put a blue right here, well, if you can see it. This is the pericardial fluid. So the point here is to know what is the major function of this. This little membrane, the pericardium, acts as a cushion, like a little pillow surrounding the heart. So when the heart beats, or we move, or we play, or we jump, and there is movement inside the heart collides with the organs surrounding the chest cavity. It doesn't bruise. So this is to protect the heart from bruising, because I have something that is like a little cushioning surrounding them to prevent that to happen. Just the fact that the heart is beating, when it do that, it expands and hits the neighboring organs, structures, and it's very fragile. So for that reason, have something that protects it. And this liquid inside makes that happen, so the heart doesn't get injured. Is that understood? So one of the things that you need to understand is like not this part. It's for you to understand the function. If it's that little membrane, sometimes you said, wow, that little membrane doesn't mean anything. When you see the little membrane protecting the inner of the outside of the chicken, you say, what is the purpose? Even easier, when you boil an egg, have you boiled eggs and then you remove the shell, and then you see a little membrane that is exactly what we have right here. And that membrane protects the shell from the inside that is very, very soft, right? So sometimes, you move the egg a certain way, you put it right here, you put it right there, it doesn't break inside. It protects the content there. So when you open it up, you have the yolk and the white part of the egg with no problem. So this is the membrane that protects that. So the reason what I'm telling you this is because there's some questions for exam, right? I don't want you to confuse pericardium with one of the layers of the heart that is called epicardium. Because pericardium sounds alike. So the next slide is going to be the layers of it. This is just a membrane that protects the heart. And the function is protection. The other one, it will be the walls of the heart. So let's talk about those walls of the heart. So we clear with the pericardium. Peri means surrounding, above. That's what is membrane that protects. It surrounds the heart. It is above the heart. That's what peri means. Cardi means heart. Means pertaining. So pertaining to the heart, covering. So that's medical terminology. But for this course, you only need to understand that this is the membrane that covers the heart. It protects the heart. So that's pericardium. Okay? So now this part they will not ask you. But I have to tell you that it's made of these layers just in case. You never know. Somebody says, oh, what is the parietal part of the pericardium? What is the pericardial cavity? What it contains? Oh, fluid. Pericardial fluid. That's it. So you heard about it. It's not like you never heard about it. Now we're going to talk about those walls of the heart. So the heart has 3 walls or layers. Remember, the outermost is called the epicardium. You see, epicardium, when you're not familiar with these terms, pericardium, epicardium, I used to mix them up all the time. I see them together in an answer. I didn't know which one was the layer that protects, or was the membrane that protects the heart, or which one was the first layer or the outer layer of the heart. Because it tends to drive you that way. So basically, that's what I want you to understand. So, pericardium, remember peri, surrounding, the outside membrane. Epicardium is the first wall, the first layer of the heart. The outer layer of the heart. Now we have it right here. If you will look around here, this will be, see, this is the pericardial cavity. Now right here, this little line right here, this will be the epicardium. It's very thin layer. Then we have myocardium. Muscle. Myo means muscle. Myo means middle. Muscle, middle. You remember the word that I mentioned before, right? Myocardial infarction. Well, it comes right there because the myocardial infarction happens in all these huge areas. See, this is the muscle of the heart. The muscle of the heart is the most important layer of the heart. Everything else is like on the sides, very thin. So this one, this little line right here, that's the endocardium. So whenever we talk about the heart, the most important thing, the most important layer wall, it will be myocardium. M stands for myo, middle, muscle. Here is where the contraction happens. The heart contracts, pumps blood, relaxes, allow blood to seep in again, so it contains like this. It's because of the muscle, not because of the epicardium, not because of the endocardium, no. It's because of the muscle. So questions for the exam. Which layer of the heart is the one that contracts the heart? Myo, the muscle. Right. Yes, that's the one that squeezes. It contracts. Contracts means the heart becomes small. It's like me clenching my hand. Because when I clench, it squeezes all the blood out. Then relax, it fills with blood again. Squeeze, again blood. Relax, allow the heart to fill in with blood. So that's how it works. So endo means inner. Endo means inner. Hardy, remember, heart, UM, pertaining to the inner layer of the heart.
Myo means
Muscle.
middle and muscle.
Yeah,
Okay.
middle, muscle. So anytime that you see the word M for myo, think of, oh, it's the middle layer and it's the muscle. Because they're going to ask you, which layer of the heart is considered the muscle of the heart? Myocardium, because it's M for muscle, M for myo for middle. Not the heart, right? Well, we're talking about the heart. So yeah. See, I tried to make it simple. What am I going to give you all this medical jargon right there? First of all, you're not going to understand it. You're not going to retain that information. Simple is better. Basic. You don't have too much like to read. Then you focus just on this part. When you focus on this part, you're going to be like, yeah, that's what I want. That's all I need. And the name of the cavity of the heart?
Pericardium.
Pericardium. How many layers the heart has? How many layers of walls? 3. The middle layer, what is called? Myocardium. Correct. Okay, so we covered already what it is, the muscles, the big shelf of the heart. But inside the heart, there is a space. We're going to talk about those cavities. There are 4 cavities inside the heart. So the heart, well, what is the blood going to run through if it was all muscle, right? It's not all muscle. It is a pump. So inside the heart, we have a space right there. That space within the heart is divided in 4 chambers. But one of the things that we're going to do is we're going to divide it in between the right side of the heart and the left side of the heart. Remember, we talked about that already, right? The heart has 2 pumps, the right side and the left side. Now we are going to have 4 chambers, 4 rooms inside the heart. Let's think about the heart like an apartment that has 4 rooms. It has a bedroom, it has a living room, it has a kitchen, and it has a bathroom. Just put it that way. And each one of these rooms, in order for me to access, to go inside these rooms, what these rooms needs? Doors, of course. So those doors, we're going to call them valves. Later on, we're going to discuss those. Every room has to have a door. How am I going to get in? Has to have a door. They are not enclosed. So we have 2 upper chambers and 2 lower chambers. The upper chambers are called atria. The lower chambers are called ventricles and ventricles. So the upper chambers So let's say that we have this. This is so good. I have the drawing next, but I want you to focus on this. So let's say that this is the heart. Of course, this is not the shape of the heart, right? But to make it simple, the heart is divided in 4 chambers. 1, 2, 3, 4. This upper part are called the atria. And these ones down here are called the ventricles. Right? That's basically what it is. Atria, ventricles. Now, if we talk about them individually, learn the names, because sometimes they ask you the right side, the right upper chamber of the heart. What is the name? Right atrium. Atria is plural. Ventricles, of course, is a lot easier, right? But if I said the right ventricle, but if I said ventricles, means I'm including right and left. Correct, both. So that's what I want you to understand this. So it has 4 chambers. The upper is called the atria, and the lower is called the ventricles. Why are these chambers so important? Remember, we have the right palm right here, the right palm, and we have the left palm. We have the pulmonary circulation, and we have the systemic circulation. Because remember, the right side blood does not have oxygen. This gotta go through the lungs to get the oxygen. The left side already really is the one that it is oxygenated. So this is gonna be distributed in the whole body. Well, when we evaluate the functioning, the electrical impulses of the heart on an electrocardiogram, we are measuring the amount of blood that runs through these chambers. And what is the blood major function? What does the blood carry? Oxygen. Without oxygen, our body collapses. We cannot function. And if the heart is not functioning correctly, if this pump is not providing us with that oxygen, with those nutrients, with those calcium, potassium, sodium, magnesium, hormones, nutrients, water, then our body is going to collapse, right? Because the heart is in charge of removing all these wastes through the right side and then cleaning it up and sending the clean blood to the system. It's like you drinking dirty water. You're gonna get sick, right? So our body will get sick when this blood is not clean enough. So that's basically what it is. So it says right here, the right atrium receives blood from the superior and inferior vena cava, then pumps blood to the right ventricle. Well, I'm just going to mention now, but I'm going to show you a picture, and we're going to kind of draw the blood flow. Is that understood? So you know from where to where this blood is going to go. So you can get a better understanding. The left atrium receives blood from the lungs, then pumps the blood to the left ventricle. We're going to see how that works. The right ventricle receives blood. Now, notice something. The right atrium receives, the atria receives blood. Both of them receive blood. The upper chambers are the recipients, the receivers. Is that understood? They receive. All the blood comes to the right and left. That's it. So what is it that the ventricles are going to do? They're going to discharge. So they're going to pump. These chambers on top receives blood. The other ones pump it out. One to the lungs, one to the rest of the body. So that's how it's going to work. So let's move to the next slide because I have a picture there. Let me know when you guys are ready. Before we meet that, remember we're going to talk about the doors that are going to be opening to these chambers, right? Because you have to have doors. Other than that, how that's going to work. Let's talk about the valves of the heart. Now, what is the purpose of those valves? Those are the questions for exams. What is it that we have doors?
It's to maintain the blood that's in the chamber.
To keep out the production needed from the oxygen?
Probably. But what do we have this door right there? Tell me.
Contain.
If I put a door on my house, what do I put a door in my house? Why don't just let it without doors? To keep certain people who I don't want them to come to my home, right? So here, these valves, the purpose of these valves is to prevent backflow of blood. So let me explain you right here in this picture. So that's question for your exam. Pay attention. What is the function of the valves? To prevent backflow of blood. Okay, Professor, how is that going to happen? Let me remove all this information from here. So I'm going to have a valve, one here in between the right atrium and the right ventricle. You see this valve? This valve connects with this because this is the right side of the heart, remember. And the blood here has no oxygen. So this valve connects with this one. Now the blood from here goes this way. But preventing backflow is as soon as the blood from here passes here, this valve closes. Because I don't want this blood to go backwards. Because that doesn't work. This blood has to follow the direction. Where does this blood goes next? To the lungs. Not back to the right atrium. What about here? There is another valve right here. What is this valve purpose? What is the function? To prevent blood that comes from here to go backwards. So as soon as the blood seeps and fills in right here, this valve closes. Our body is the smartest machine ever. There is nothing compared with our body. And everything happens without not even realizing it. How do you know what time this closes, opens, when the blood is passing? You don't know anything. But we know when we are not feeling well. And then we go to the doctor runs some tests, some questioning, some exams, some interview, and then finds that probably something is not functioning in our heart. So that is how it works. So these valves prevents backflow of blood. Anything that is right on top goes down, it should stay there. It should not go backwards. What happens when this blood goes backwards? It's when we leave the door open, the front door, or the door of our room, and we have other guests in our home. Well, they can peek inside, they can go inside anytime. Why? Because the door is open. If we allow this to go backwards, the heart not functioning well because blood that is supposed to go to the other end now is going back. So how much blood do I have here? Not much. Not enough. From here I don't have enough because it's going backwards. Here it's going backwards, so I don't have enough to pump to the lungs to get oxygen, and I don't have oxygenated blood enough. Patient start complaining. That's when the patient develops chest pain. Says, oh, I have pain in my heart. I can breathe. I barely breathe. I'm tired. I feel so, and they collapse. So this is how functions.
So I have a quick question. It's not. I mean, it's ever related to this.
Mm-hmm.
So my niece was born with a congenital left ventricle. Is it like it was really small?
Mm-hmm.
That means the oxygenated blood couldn't go through the body, right?
Okay, she was diagnosed with a hole in the heart.
No, not a hole. The left ventricle, it was really small. It didn't develop.
Oh, okay.
Yeah. So that's what it means, right? The
That's a
oxygenated
congenital,
blood,
yeah.
It wasn't.
Correct.
Okay.
Because it's so small that don't have room
Mhm.
to fill in with blood.
Okay.
And I don't know if the muscles are working properly. Even though if it is small, it can still hold blood and pump it out. Because most of the children that has problems with the heart is the hole in the heart. They have a murmur. Because these chambers, when you are a fetus, all them connect to each other. And when we are born, these fix, they the wall fixes, and the blood goes this way, the right way. Because remember, when we are a fetus, who gave us the blood? Our mothers. Then when you were born, now your body, your heart, start functioning by itself. Now it closes all the breaches. Because we're using the mother's oxygenated blood. So most of the times but that's a congenital disease of the heart. And that's serious because you can repair it.
They try, but
The surgery is very hard. So basically that's what it is. This will be the two first valves. Atrioventricular. What do they call atrioventricular? Because they are between the atria and the ventricles. So it says right here, two atrioventricular valves, the AV valves. Because remember, these are the doors, the valves that are located between the atria and the ventricles. And because we have right atria, right ventricle, left atria, left ventricles, there are two valves right there. Where are the other two valves? Well, if I have a door in between the atria and the ventricles, when the blood reaches the ventricles, where is the blood going to go if it is closed? People enter from that side to this side. Now this closes, you cannot go back. How do you escape? You have to have another valve. One that goes from the right ventricle to the lungs, one that goes from the left ventricle to the rest of the body. Yeah, because something that enters here cannot stay here, but cannot go backwards either. So it has to have an exit. So we're gonna have a valve right here on the right ventricle, and this goes connected to a blood vessel, and it goes to the lungs. And then we're gonna have another valve right here on the left ventricle that takes oxygenated blood, and it goes to the rest of the body. So that's what we call it pumps, remember. Now we're gonna get this blood that don't have oxygen. Oh, let's send it to the lungs to get oxygen. Now, blood that passes through the lungs sips on the left side. Now we have the left side blood that contains oxygen. But we need to distribute this blood that has oxygen to every single cell of our body. So then it goes to the left side. These two valves that are located within the ventricles are called the semilunar valves. Now, what does semi means? Half.
I was gonna say not complete, but yeah.
Right. Just throw it. And what is lunar? Moon. Luna. Semi-lunar. So it's like half of the moon. So these bulbs look like half of the moon. Like this. Are you okay?
Yeah, my allergies.
Oh. You're like me. I'm surprised that I'm not sneezing without air conditioning. All these weather changes, rains and changes, the season changes, give me allergies. I try every single antihistamine, anti-allergic medication there is. I've tried. They work, right? And you know how dangerous is the train station. If you kind of try to check the tracks, you might end up right back there. So then I was going downstairs to take the train when I felt something very weird. I said, oh my God, I feel like I'm fainting. I felt like passing out, like blacking out. I was like, I hold myself like that. I said, oh my God. I got so scared. Because as a medical doctor, immediately you think of all the worst. I said, oh my God, am I having a heart attack or something like that, not even knowing? And I was shaking after that, very nervous. And then I said, oh, I took air, I was kind of breathing slowly, like this, and then I went down, I took my train, but I was a little uneasy. Then it happens to me again, and again, I was definitely very scared. So then I said, no, I'm gonna call my friend, I'm gonna go to the cardiologist. I'm on insurance, so I just can go pick anyone that I want, but this is my friend. And he will do the test that I really needed. And I can tell, so listen, then I have the Flonase right, and I started looking at the Flonase, and I said, wait a minute, I recommend all my patients to read all the instructions about the medication, the insert that comes with the medication. But I don't do it myself. But I never thought that something so simple will have the side effects. I read the insert, I went online, and I checked Flonase, and one of the side effects was dizziness. When I look at it, I said, I'm stopping this right now. I deal with the allergies. And that's it. That was the end of it. But if I have not known, I have gone and put me on EKG and cardiac this and cardiac that and do all these MRIs and all the, because I know that's what they do. And then I was like, hello, just check. Because they will ask me, do you take any medication? No, because I don't take anything. Because usually when you take over the counter, you think that it's not. So then I said, oh my God, the only thing that I'm taking is this stupid Flonase, and it works. So I kept it. It's the spray, right, that you put in your nose. Oh no, they have the little kind of, drip that goes through your throat. But listen, I'd rather get that than these allergies. This sneezing and these tearing eyes and itching, that's so bothersome. Particularly when you have to work like this, or you have to take public transportation. People immediately look at you like you're sick. Said, oh, no, COVID. Oh, this or that. No, people look weird to you. So I said, no.